Welcome to Brain Health Unchaining Your Pain live training and Q&A. For those that don't know me, my name is Dr. Ruth Mary Allen. I'm an executive coach, motivational speaker and trainer, and particularly high performance coach, brain health professional, and havening practitioner. And I'm also host of the show Brain Health Unchaining Your Pain. And I am delighted to be with you here today. And so, what are we really going to talk about? So, we're really going to focus on COVID-19 and the brain. And for me, it's really important because we're seeing that the R number here in the UK is rising. We're noticing more and more people are getting infected despite having been vaccinated. And that includes myself and my daughter Lily, who is 2. And a lot of the attention has been on how can we minimize people going into hospital, which is absolutely right. And that is what the vaccinations do. But there's been very little attention into how can we help people effectively recover from COVID to minimize the risk of getting long COVID, and how can we support people in preventing them contracting COVID and minimizing the extent of the infection that may take place in the first place. So just in terms of what you will gain from this training, the focus is to give you a deeper understanding of how your brain works, an insight into how COVID-19 enters the body and really attacks the brain, the key mechanisms that influence virus entry, the impact that COVID can really have on your brain. And this is really early stuff, so I'm going to present you here some work that's never before been presented, and simple steps that you can take to aid your recovery from COVID and also restore your brain function. And there will be offer at the end of this presentation to help you really take action yourself and equip you with a new tool and technique that can really help you and your loved ones calm down the activity that may be induced in your brain as a consequence of COVID. So just in terms of session etiquette, please don't record the presentation. Please post any questions that you have. I request that you will do that through support@ruthmaryallen.com, because I'm not sure I'm actually going to see any comments through these means. So please send me any questions, and if I can't answer them at the end of this session, I will post the answers when the recording of this session becomes available later. If you can see any chat roll, then please be polite. Do take notes. It's really important that you do, so that you can learn. But again, this presentation will be made available so you can take notes at your leisure if you wish to watch this later. So how does your brain really work? Well, your brain is involved in everything you do. It's responsible for how you feel, how you act, how you connect, how you think, and how you sense the world around you. And that forms the 5 pillars of brain health that I will touch on throughout this presentation, which is remembered by the mnemonic facts, feelings, actions, connections, thoughts, and surroundings, and how your senses connect with your surroundings. It's the organ of intelligence, character, and it's responsible for every decision that you make. Yet we rarely talk about the brain, and we rarely talk about it in the context of COVID-19 and what impact that has, and the impacts can be quite extensive. So just a breakdown of your brain systems and behaviors at a surface level. So at the front of your brain, you have your prefrontal cortex, which is responsible for focus, forethought, and impulse control. In the middle, on the top surface of your brain, is the parietal lobe, which is responsible for sensory processing and your sense of direction. At the back of your brain, which is where your brain first starts to myelate from being a baby, is your occipital lobe. That's responsible for visual processing, which is why your visual processing centers come online first. Deep underneath that is your cerebellum, which is basically your brain's computer processor, and that's responsible for motor and thought coordination. And then at the sides of your brain, behind your ears, you have your temporal lobe, which is responsible for memory, learning, stability, visual and auditory processing. And we'll come to some of these aspects of our brain systems later on in the presentation. Inside your brain, so deep within your brain, are specific structures. In the inside of the brain, from your front to your back, you have your anterior cingulate gyrus, which is your gear shifter. That's responsible for your flexibility, cooperation and error detection. So I have an overactive anterior cingulate gyrus, so it's often my way or the highway in my world. And I like things to be particularly done in a certain way. I'm pretty certain my daughter Lily has the same overactivity, which has been inherited from myself. She loves to put things in absolute meticulous order. It's typical of having an overactive anterior cingulate gyrus. Deep within our brain system, we have the basal ganglia, and they're two, one on either side. They're deep down, just above the brainstem, and they're responsible for pleasure, motivation, adjusting movements, and they're also our anxiety centers. Now, I do have overactive basal ganglia, so I do have anxiety, and this is one of the areas that does get impacted as a result of contracting COVID. And then deep down, which is one of the oldest parts of our brain, just above the brainstem, often called part of our reptilian brain, is the deep limbic system. That's responsible for memory, learning, mood stability, and visual and auditory processing. And that is actually one of the areas that can be severely impacted by COVID-19. The root causes of which are still unclear, still needs to be further research to understand how that activity happens in the brain, and how the COVID virus causes that change in brain function. And I'll put forward some suggestions as part of this presentation, as well as details from the literature. So, key thing about your brain, it's very soft, yet it's housed in a very hard skull. It's about the consistency of soft butter or tofu. Your skull is very hard with sharp bony ridges, so brain injuries do matter. Why am I saying this in the context of COVID-19? Because it's really important that we understand the history of our brain to really learn how vulnerable our brain is in the context of contracting, not just contracting COVID-19, but the likelihood that we may have struggles associated with COVID-19 itself that are amplified as a result of the infection. So our brain can be measured in all sorts of ways. Typically, it's done through MRI or PET scans or CT scans. They often just look at the structure of a brain. They don't study the function of our brain, which is looking at the blood flow, looking at which aspects of our brain are working too hard and which aspects are not working hard enough. So if you look at this image, the one on the left is normal activity. That's when your brain is functioning appropriately, and that normal may be different for different people, but that's in essence what we would like to see, is every region of our brain is pretty calm, and there is a high level of activity in the cerebellum, which is the bottom part of the image on the left. When your brain is in trouble, we see much higher levels of activity, and here we see a brain that's pretty much on fire. We've got overactivity in the prefrontal cortex regions, the anterior cingulate gyrus, which is the strip in the middle. We've got overactivity in the basal ganglia. We've got overactivity in the deep limbic system, potentially the amygdala, which is part of the deep limbic system. And I'll talk about the amygdala later. And all around the side of the brain and the temporal lobes. And it's quite possible that that person is an epileptic or something like that. So I don't know the details behind that person, but often we see overactivity if people have those particular conditions. So we need to think about our brain in the context of our brain reserve, and our brain health is defined by the amount of brain reserve we have, and that's dependent on what we do throughout our life. So our brain reserve, we get a certain degree of brain reserve the moment we are born. That's dependent on how we're grown in the womb, and that brain reserve declines over time, and we all have our own particular curve in terms of how that decline takes place. Now, typically from a mental health perspective, what we look at is when we become symptomatic with mental health issues or mental ill health, is when our brain reserve has declined to a point that we have symptoms and we get into trouble. But we can also have become symptomatic with anything else that is not mental health issue. For example, Alzheimer's disease, sleep apnea, COVID-19, brain fog. There's all sorts of brain health struggles that we can experience that is a consequence of our brain reserve being depleted to the point that we express symptoms. And the key thing here is we are not stuck with the brain we have. We can make it better. We can climb up the brain reserve, and everybody has a unique curve that's dependent on their life experiences. Things that deplete our brain reserve is our lifestyle choices, our nutritional choices, any accidents or incidents we have that result in us either directly impacting our head or having a secondary impact to our head through a jolt in our body, which can include falling out of a tree, off a ladder, or being involved in a car crash. We also have aspects of our life that can traumatize us, whether that's childhood abuse, whether that's trauma from a result of being born. My daughter Lily had birthing trauma. Any trauma associated with a major or chronic illness, and trauma that could be associated with the situation we are in now, such as COVID-19, the trauma associated with the situation itself, not necessarily the actual state of your brain. So they can all deplete our brain reserve. Things that help it is having an active lifestyle, eating the right foods, basically doing the things that help your brain and avoiding the things that hurt it. Won't have time to go through all of those today. So what's the situation with COVID-19? Well, let's look at the facts. So the virus is from a family of viruses made from RNA instead of DNA, and that's particularly important in how it is structured. Many of the species produce respiratory and gastrointestinal illnesses in humans and animals, and the pandemic coronavirus is called SARS-CoV-2. It looks like a medieval weapon, which is as shown in the image. It is pretty much a globe covered in spikes, and the spikes are made of a protein which is often termed the viral spike protein, and they're really essential for viral entry into your cells. And that may explain why the new strain of the virus, which is coming out of Africa, which I don't think has as many spikes, isn't having as much of a detrimental impact or on people's health as SARS-CoV-2, because of the change in the structure to the surface of the virus and the spike proteins that are on it. In terms of COVID-19, it's highly contagious. It spreads readily within groups. It's often spread by people who have no symptoms or very mild symptoms. And the CDC in the States state that 59% of cases have been infected by someone who is asymptomatic. That's someone who had no idea that they had COVID-19. 80% of infected people experience mild illness to no symptoms at all, and approximately 3.5% develop catastrophic disease. Many people who recover are actually left with symptoms that can last for weeks to months, and people who have recovered often show long-term deficits in cognitive function, even after relatively mild disease. And this aspect really concerned me. I wasn't aware of this at the time that I caught COVID, and I was very shocked by the extent of ill health I had as a result of catching the virus. And it was really incumbent on me. I really took a deep dive, and this has come from Dr. Leo Galland, and I'll post this in the notes on the recording that you're getting of this, who's done an extensive amount of research into COVID-19. He's got a wealth of 40 years of experience in immune system support, immune system treatment, and recovery. And so part of this presentation is really focused on what do you do if you are one of these people who doesn't get hospitalized, but actually you really suffer long COVID. And I was surprised, even talking to people who I would have expected to be fit and healthy, such as a Taekwondo instructor recently in my area who had a really hacking cough that had been going for about 6 months since catching COVID. And for me, that wasn't right. I don't want people to be in that situation. I want people to know what steps they can take to improve their recovery outcomes. So key thing here also is a person's viral load determines the severity of infection and the risk of infecting others. Now, for me, I'm almost certainly caught the virus from my daughter Lily. Very close contact. I expect I probably had quite a significant viral load associated with that. And as at March 2021, 1 in 800 people in the USA had died from COVID, which is quite a high figure. Just continuing with the facts, the risk of severe illness increases with age, presence of high blood pressure, obesity, diabetes, heart or kidney disease. And that is quite a huge percentage of the American population and quite a large percentage of the UK as well. It's about 5 times more deadly than seasonal flu, and it's much more easily transmitted. And a massively important fact here is that the mortality rate of patients hospitalised is inversely proportional to the blood level of vitamin D, i.e. the less vitamin D you have in your blood, the more likely you are to be hospitalised and have a negative outcome. So it's absolutely vital, as one of the key steps that you take, is to optimise your vitamin D levels. Those, which I had done, by the way, those that had a 40% increase in consumption of vegetables. This was an extensive study in the States done with some doctors, and that was very well controlled, who had 40% increase in the consumptions of vegetables a year prior to infection, resulted in a 70% reduction of moderate to severe infection. This is massive. If we had a drug that was claiming those results, everybody would be taking it. We'd be taking it every day. And the message here is eat more veg, eat as much vegetables as you can. That's a whole food diet. Doesn't mean you have to cut out meat, but it's eating from the rainbow, eating a wide variety of vegetables and berries, and I'll go into that later. Vaccines. So vaccines for COVID-19, the focus on vaccines has been to reduce the incidence of severe infection or the need for hospitalization or death. Now, really, the focus of the vaccines has been to stop as many people go into hospital. That doesn't stop people from getting long COVID. Vaccines are less effective at preventing mild or asymptomatic infection and extremely unlikely to create herd immunity, as was maybe claimed by some governments at the beginning of the pandemic. How they work is all types induce your cells to make a foreign protein, which is different to other vaccines used. Pfizer or Moderna are a more direct approach. They contain a substance called messenger RNA, and that enters your cells and directly organizes the synthesis of the viral spike protein. It's not infectious, but it's not part of the virus, but it does stimulate a strong immune response. So that can actually lead to inflammation, and that could contribute to some brain health struggles as a result of the way in which your immune system responds to those types of vaccines. AstraZeneca and Johnson & Johnson, they take a live non-pathogenic virus, which normally infects chimpanzees, and they insert fragments of synthetic DNA that codes for the viral spike protein. So it's a more indirect way of inducing the cells to make the foreign protein. And the synthetic DNA enters your cells and makes them create that messenger RNA, which organises the synthesis of the viral spike protein. So it's quite different in terms of how it works. Risks of vaccines, which has come out as a question. Anaphylaxis, 11 cases out of 1 million shots that people had anaphylaxis, which is incredibly low. Autoimmune diseases, which could be triggered by the robustness of your immune response. Again, the numbers are incredibly low. And really, ultimately, the risks are low, and the consequences, in my opinion, of not having the vaccine are far greater. And there's nothing to substantiate, really, as discussed by Dr. Leo Galland in his report, of the counter arguments to not having the vaccine. So how does COVID-19 enter your body? Well, the virus entry is through your nasal passages. So it's important that if you're going to wear a face mask, you wear it over your nasal passages to cover. I see a lot of people walking around covering their mouth. That's going to do them absolutely nothing at all. It needs to cover your nose, because that's how the virus enters your body and also your bloodstream. And what we find here is the virus actually goes into attacking the olfactory nerve, which is why we tend to lose that sense of taste and smell. So, as I said, it principally enters through the lining of the nose, where it replicates before it goes into the lungs, where pneumonia can occur. The initial viral load that goes into the nose is a key factor to determining the severity of infection. As I said, make sure you cover your nose with a well-fitting face mask. The role of the nose as an incubator suggests an antiviral nasal spray may help decrease transmission. And what happens is SARS-CoV-2 can also attach to cells in the small and large intestine too, which appears in bowel movements, which can result in the particles becoming airborne when the toilet is flushed. So we mustn't discount the fact that what goes in must come out, and that can also lead to entry into our bodies. In terms of the stages of infection, the phase 1 is an incubation period from exposure to illness of 12 to 14 days, with the average of being 5 days. Common early symptoms are fatigue, aches and pains, headache, maybe a sore throat, dry cough, stuffed or runny nose, nausea, loss of appetite. Now, I experienced fatigue, but principally aches and pains when I first contracted it, followed by headache. I didn't actually develop a cough until quite a bit later. And symptoms may include mouth or tongue spores, diarrhea and skin rashes and mottling. And these symptoms typically last 5 days, and hopefully that can be followed by recovery, but not necessarily. And it did take me a lot longer to recover too. Moving on to phase 2, this is where it takes longer to get over it. It affects 20% of infected persons. And this is definitely the phase that I entered. We have an increasing cough, shortness of breath, worsening fatigue. I definitely had that. Brain fog. I experienced dizziness. I did not experience mood stability, but I was very conscious on managing my mood, because I knew my vitamin D levels were optimized, my omega-3 levels were optimized, and I also took saffron to help manage mood, because I have had depression in the past and I wanted to minimize the risk of that developing again. You can have abnormal swings in your heart rate and blood pressure when going from lying or sitting to standing. I definitely experienced that. That could be indicative of damage to the autonomic nervous system. And you may experience reduced oxygen levels. Less than 93% requires emergency evaluation. These often occur before respiratory symptoms, so it's helpful to have an oxygen oximeter in your house, and they're very cheap. And then up to 50% of people with phase 2 experiencing fluctuating symptoms that can last for weeks. And mine definitely lasted for a few weeks. And I took the time of 4 weeks out at least from exercise before going back into doing any major exercise again. So stages of infection, if you move into stage 3, this is in essence hospitalization. You can transition from to phase 3 from phase 1 or 2, and that can be very, very sudden. Complications often include blood clots, strokes, pulmonary embolism, neurological or cardiac problems, kidney failure, and bone marrow suppression. Low lymphocyte count is also indicative of a poor outcome. And this transition into this phase may reflect the fact that ACE2, which is really vital within our cells and which is attacked and destroyed as part of the virus entering our cells, becomes exhausted and can no longer perform its function throughout the body, which is why we see catastrophic organ failure. So phase 4, which is long COVID, this is a phase that many people have moved into. It is completely independent of whether you've had a vaccination. It doesn't matter whether you've had minimal symptoms or moderate symptoms, you can still get long COVID. There's at least 50 symptoms and conditions identified. Common is fatigue, brain fog, headache, breathlessness, pain or pain aggravation. So if you have an existing pain, that can be amplified. But you can also develop new pain as well. Loss of taste and smell, mood swings, circulatory problems, which can continue for weeks or even months, and that can fluctuate in intensity. Possible root cause not fully understood, but it may be persistent inflammation, and that's why it's so important that we focus on doing what we can, that we are empowered to do ourselves to reduce the level of inflammation in our body. Other factors that can contribute to this is changes to your microbiome, which occurs as a result of the virus attacking ACE2 within your microbiome, that's in your gut. Damage to the cellular powerhouses, which is your mitochondria, and also damage to your heart and nervous system, scarring of the lungs, persisting depletion of the enzyme ACE2, and it may, basically this may impact all organs. What they've also noticed as well, which is quite surprising, is within 6 months after infection, people are more likely to be treated for new conditions such as diabetes or high blood pressure, as well as a new psychiatric disorder. And I'll go on to that in the presentation in a minute. And these long COVID symptoms are rare if you are asymptomatic. So key mechanisms for viral entry. First of all, the virus spike protein attacks your cells, and it clings to heparin, which actually coats your cell membranes. And that's basically it's clinging to the door within the gate to your castle, where your castle is your cell. In step 2, the protease furin, which is an enzyme, shortens the spike protein, basically turns it into a key, and it allows the receptor binding protein, which becomes the key, to attach with ACE2, which is on the surface of the cell, which is the lock that allows the virus to enter the cell. When that door is opened, in the process of that door being opened and the virus gaining entry, ACE2, which is a protein which is embedded in the membrane, which is really critical, is destroyed. And we also see that other functions happen within the cell. We're not going to go into that because we're going to run out of time. In essence here, TMPRSS2 is suppressed by estrogen, but amplified by testosterone. So this is possibly why men have worse outcomes than women. So what are the cell consequences? Well, our enzyme ACE2 is absolutely vital to our health. It protects our blood vessels, our heart, our brain, our lungs, our kidney, bone marrow from damage. It improves circulation, it inhibits inflammation, it prevents abnormal blood clotting, and it enables healing without scarring, which is it's really this enzyme that gets massively attacked. It's the one that gets really depleted, And what happens is with the destruction of ACE2, we have an increasing severity of COVID-19, and the loss of it really underlies the terrible complications that we see in COVID-19, which includes pneumonia, heart failure, and so on. So it's really important that we equip people with the tools to replenish ACE2. And what we've also noticed is damage to the intestinal ACE2 produces abnormalities in the gut, leading to leaky gut and subsequent damage to the heart. Now, we know through the vagus nerve that there is a strong gut-brain connection. Over 90% of the serotonin that we require for our brain is made in our gut, as well as many of the other neurotransmitters vital for our brain health. And this may be one of the reasons why we see increased number of psychological symptoms as a result of the damage to the intestinal ACE2 that occurs. So what happens is once the virus is inside the cell, it takes over the normal cellular machinery and starts replicating itself into from its large protein into 16 smaller proteins. A particular protein, 3CL protease, is essential for viral spreading. And what happens when ACE2 is destroyed is that the inflammation that occurs damages the mitochondrial powerhouses that generate the energy that you really need to live. So 90% of the energy that we need to live originates in our mitochondria. And this mitochondrial distress can continue into the phase of long COVID. So what we really need to focus on is basically replenishing ACE2 and also helping our mitochondrial recovery or mitochondrial rescue. And I'll talk about that later. And this is quite possibly why we have this massive depletion in energy, why we have a brain fog, because basically our mitochondrial, that ability for us to generate energy for us to function, has been depleted. The consequences in the gut microbiome is that we have damage to the intestinal ACE2, as I've said, that's leaky gut and subsequent damage to the heart. We have a decrease in the diversity and richness of the bacteria in your gut, so it's vital that we focus on optimizing the health of our gut bacteria. And also COVID-19 increases yeast and fungi, which is the unhelpful bacteria in our gut, which can exert undesirable effects on our immune system, can result in further inflammation and affect our metabolism. So it's not good news, really. So how does COVID attack your brain? Well, normally we'll see initially a loss of smell. I didn't experience this myself. When it's not associated with a stuffy nose, this can be caused by swelling at the top of the nose, which is called the olfactory cleft. And this is due to viral invasion of the sustenacular cells surrounding and supporting the olfactory nerve. And in this instance, the swelling can damage the nerve by releasing these inflammatory chemicals called cytokines that actually damage the nerve itself. Also, the swelling puts pressure on the nerve, which is also called neuropathy. What have we seen within the brain from a clinical perspective? This is work done by the Amen clinics using SPECT images. I do not have the full details of these patients, but in essence, they had SPECT scans of patients before they contracted COVID, and then they retook those SPECT scans after COVID. And what you can see here is the base of the picture is your cerebellum. And we see overactivity in the center of the brain. That's the deep limbic system that I discussed at the beginning of the presentation. We see overactivity in the basal ganglia. So the deep limbic system is responsible for our mood control. It also contains our amygdala, which is our fight, flight, freeze, or defensive rage part of our brain. Deep limbic system is often part of the body that is part of the brain that is deeply impacted due to depression. So if we've got overactivity in the deep limbic system, we're more likely to become depressed. And obviously we've got heightened activity in the basal ganglia, which are the anxiety centres. So we'll see people that are more anxious. And the root causes of this are not clear, but I'll talk about what I think they could be later on. What they also note from these images, the SPECT scans, which looks at the function of our brain, not the structure. So this is how is our brain working, is that those people that are long haulers, i.e. those that have long COVID, I've got one patient example here. You can see that there is low cerebellum and activity in the cerebellum, which is the central processor part of our brain, really vital for brain function, and lower overall perfusion as a result of contracting COVID. And this could be a result of ACE2 exhaustion and huge impact to mitochondrial function and loss of energy. However, the mechanisms behind why this has happened is unclear. I've not seen that discussed yet. So in terms of what is known with regards to the impact of COVID on the brain, it's not believed that there's little inflammation or viral entry into the brain as a result of COVID, with the exception of olfactory nerve. Now the olfactory nerve has a direct link into our amygdala, so it is as a direct route into our amygdala, which may be a result of increase in the deep limbic system. We've got inflammation in our amygdala itself. Most problems are due to circulation being impaired and the effects of systemic inflammation in the virus on supportive cells, which is called the glial cells, releasing inflammatory protein. Now, that's really important, because what we see from other parts of the body is we have a loss of flexibility of the arteries to vital organs, including the brain, which is due to inflammation of the lining of the blood vessels. So again, we come back to this inflammatory response and the need to really reduce that. We see impairment of higher brain functions, especially problem solving, attention to visual details 3 to 4 months after a diagnosis. And there could be many root causes for that, not studied very much. They have noticed changes in MRI scans to the brain after contracting COVID, including a loss of grey matter, which is brain cells, as a result of circulatory disturbance. So I'm just going to take myself offline and just give you a chance to have a read of that while I just grab myself a tissue. So this is what I think could be causing the brain struggles with COVID-19. So generally, as I've discussed on the previous slide, we see reduction in blood flow. Blood flow is the #1 imaging predictor, functional imaging predictor of Alzheimer's disease. So where we have a reduction in blood flow, the long-term consequences of COVID-19 are still yet to be discovered. But we could see in later generations, as people get older, a rise in Alzheimer's disease, of which there is no cure. So it's really vital we look at how can we enhance blood flow throughout our body if we have contracted COVID-19, to make sure that that isn't going to affect us long term. And there are things that reduce our blood flow already, which includes alcohol. So a lot of people have been consuming alcohol. They've gone into binge mode as we've been in lockdown, increase their alcohol consumption. That is not going to do you any favors if you contract COVID-19, because you will have already impaired blood flow to your brain. Other things that reduce blood flow, smoking is not a good one either. That sufficiently restricts blood flow to your brain. as well as caffeine. Excess amounts of caffeine is no good for you either. Sugar isn't good, that increases inflammation. So we really need to focus on steps that we can take to reduce blood flow, to increase blood flow, I'm sorry. Then we have systemic inflammation, that's secondary inflammation, which I mentioned earlier, that can be caused within the brain. And that could be a consequence of the lower activity in the prefrontal cortex. So what we know from functional brain imaging studies is that if you experience a traumatic brain injury, as I have done, and I have moderate traumatic brain injury, which has been assessed by the Amen clinics, and that's a result of multiple minor knocks. That has affected my brain function. It's damaged my temporal lobes, and it's damaged my prefrontal cortex to a certain degree, but principally my temporal lobes, making it harder has made it harder for me to remember things, and that I have not massively, but sometimes mood stability issues, which are a function of the temporal lobe. But principally, the issue for me has been as difficulty in retaining memory. The same inflammation is likely to affect all parts of the brain. Now, the long COVID case could be a result of extensive inflammation throughout the brain, which is basically reducing blood flow into the cerebellum. And also, as we've said, we've had loss of brain cells, and that would be really important if the loss of brain cells is in vital regions of your brain, including memory. Psychological impact, this could be caused by disruption to the neural pathways that occurs as a result of COVID-19 attacking your neural networks. You also, people have experienced an extensive amount of trauma from the pandemic, even if they haven't caught it. And it could be trauma from the effect of catching COVID-19. So the actual experience of catching it has traumatized them, parking the impact that COVID actually had on their brain. The physical trauma that occurs has activated their fight, flight, freeze, or defensive rage part of their brain, put them into a heightened state of anxiety, a heightened state of response. And that has made it really difficult for them to bring that heightened state, that overactivity in the deep limbic system, that overactivity in the basal ganglia, because they've become super anxious, all triggered by our deep limbic system, our amygdala, the reptilian part of our brain that's responsible for fight, flight, freeze, or defensive rage, coming online because we felt that we are going to die, or we are going to lose something: loss of life, loss of job, loss of emotional well-being, loss of our physical well-being, loss of our mental capacity to function. There's all sorts of losses that we can experience in our brain. Our reptilian brain can't differentiate between those different losses, and so it goes into that fight, flight, freeze, or defensive rage. And that's what we see with people who have PTSD, as we have a diamond pattern in the brain, which is where we have the anterior cingulate gyrus, which I talked about. It's the front part of our brain that's come on, which is the red in the top center of the brain. The basal ganglia centers get heightened, and the deep limbic system gets heightened. And that creates like a diamond pattern, as well as our amygdala. So that could be what is happening, is people are significantly traumatized. And then a secondary impact as a result of COVID-19 is the fact that our microbiome is being hugely disrupted, and this disruption in the microbiome has depleted the amount of essential neurotransmitters that we need for our brain to function effectively, for us to have that get up and go mentality, for us to calm our brains down. The GABA could be depleted. There's all sorts of neurotransmitters that could be affected. I don't know the science behind this, but I'm just postulating that that could have a huge influence on our brain function, particularly in the context of our long COVID. And brain fog, it could be driven by inflammation. It could also be driven by overactivity of the deep limbic system, which makes it really, really difficult to bring the newest part of our brain, the human part of our brain, online and makes it hard for us to concentrate. So that could be one of the reasons. Again, the other reason could be an absolute depletion in the energy stores that we have in our mitochondria, which is affecting our ability to function overall. I hope that makes sense. Possible causes of the brain impacts, as I said, disruption to the microbiome. Many of the neurotransmitters are made in the microbiome, such as serotonin, which is responsible for happiness, GABA, that controls fear and anxiety, that's used to calm down the deep limbic system, norepinephrine, which is increases our heart rate and blood pumping, that helps break down fat, and it also provides more energy. That could be impacted as well. Acetylcholine, which influences synaptic transmission, coordinates firing of neurons. Again, that could be impacted in terms of the volume that's generated, and that may result in the misfiring that's occurring. Dopamine is responsible for motivation. That could be depleted, making it difficult for us to concentrate. And melatonin, which is our time cue for our circadian rhythm, and it also promotes sleep. So, and again, sleep is another one of the 11 risk factors associated with Alzheimer's disease. So it's vital we do something about this. How do we prevent it? So wear a cloth face mask that fits snugly over the bridge of your nose, and wash it daily. Get vaccinated. Antiviral hygiene is really important. Cleanse contaminated substances, all the normal stuff. But optimize your sleep, really important. Eat more fruit and veg. Do not go easy on the fruit. Eat as much, or the vegetables, importantly. Eat as many green vegetables as you like, including onions, apples. Just basically eat the colour of the rainbow. So quercetin, which is found in onions, apples, and other fruits, prevents the viral spike protein from attaching to ACE2. You can use elderberry extract as well to help with stopping the spike protein attaching, but please do discontinue it if you do get symptoms. Supplement with vitamin D3. I would recommend at least 2,000 international units a day. There is a link at the end of this presentation to get yourselves tested. Consume a whole foods diet rich in vegetables, fruit and spices to supply the fiber, prebiotics, carbohydrates and polyphenols, particularly berries, especially cranberries, apples, prunes, pear, tea, mint, savoury herbs, rosemary, oregano, thyme, sage and turmeric. Avoid foods with high fructose and exercise regularly. So how can you restore your health then? Well, there's 5 aspects of recovery that are necessary. The first is to optimize your lifestyle for reconditioning. So that is to get yourself in the best health you can, to restore your ACE2 function, and to rescue your mitochondria. To focus on repairing any damage that occurs within your vital organs, and I'm specifically going to focus on the brain, to deal with persisting infection, and to get support psychologically, and I'll talk about that at the end of this presentation. Optimize your sleep. Sleep is the most important aspect that you can do in terms of helping your immune system and helping your brain health. It is, as I said, a risk factor for Alzheimer's disease. Go to bed, get up at the same time, all the appropriate approaches. You can use theanine to calm your mind before bed, magnesium glycinate if you struggle with going to sleep, and you can use CBD if you like. That can help with sleep, or CBN, which is even better. And CBD indirectly enhances ACE2 activity. Exercise. You don't have to go mad for it. Just walk at increasing speed and duration slowly every day. If you have breathlessness, we'll talk about later, dizziness, you could have POTS, orthostatic tolerance, you can use resistance bands while exercising, lying down. If you have breathlessness due to the way your vocal cords work, please consult an ENT specialist or consider voice training. Nutrition. Whole foods diet, basically. Lots of plant-based foods containing fiber, phytochemicals. Eat avocados and chickpeas on a daily basis to enhance your gut microbiome. And there is a great book called The Fat Resistance Diet by Dr. Leo Galland, which will contain all the details you need to know. When restoring your health, when symptoms start, there are many things that you can do. Curcumin, as resveratrol, that I found those really, really helpful. I didn't take them until I read detailed into the literature, and I found them really helpful in me restoring my function as because of the way in which they work in terms of stopping ACE2 entry into the cell, viral spike protein attacking ACE2, andrographis, uracilic acid, and there's a whole host of these things that are not normal. You can use iodine-based mouthwash. Do not swallow it, rinse it for 30 seconds. If you do develop diarrhea or abdominal pain, you can use a probiotic, Bacillus subtilis, but please do consult with your medical professional if you have symptoms that don't improve within 3 days. Oh my goodness, restoring overall health. I'm sorry about this busy slide, but I just think it's really important that you get to see this. So the goal here is to enhance your ACE2 activity, because ACE2 is in essence destroyed by the virus. So you want to control the level of inflammation. If we have depletion in ACE2 and ACE2 is shed off the surface of the cells and goes into the blood system, we have increased inflammation. So we really need to restore it. Things that do that: regular aerobic activity, high intensity interval training. Obviously make sure you're in a state to do that. Whole food diet rich in plant-based polyphenols. That includes berries, cocoa powder, nuts, flax seeds, vegetables, olives, coffee and tea, cloves, peppermint, star anise, all yummies to put in your food. Vitamin D3, eat that with food, 2,000 to 6,000 units a day with your main meal. This is really essential for ACE2 function. As I mentioned at the beginning of the presentation, those that had really unfortunate outcomes as a result of COVID-19, there was an inverse relationship with the number of volume of vitamin D3 vitamin D they had in their blood, and that is really essential for ACE2 function. Many people are deficient in vitamin D. It is important that you take a daily supplement of minimum of 2,000 units, international units a day, particularly in the winter period, up to 6,000 units. Curcumin. This is a flavonoid found in turmeric, 750 to 1,000 milligrams a day. This is a most potent anti-inflammatory effects. It's been researched extensively. Resveratrol, that supports ACE2 activity, and it also inhibits SARS-CoV-2 growth, and it's also well documented as an anti-inflammatory and anti-aging effects. And it has the effect on the circulation by mimicking ACE2, so it can support circulation as well. As I said, I took resveratrol, and you can get it from Amazon, and it was really, really helpful. Again, I've bought turmeric, curcumin off at Amazon as well. Omega-3 fats. You need 1,200 to 2,000 milligrams a day. Many people do not have optimal omega-3 levels. Of all of the family that have chosen to get that omega-3 index tested have had suboptimal levels. So it's really, really important that you take a high quality omega-3 supplement. Eat lots of wild salmon, mackerel. It is really rich in omega-3. We have omega-3 in walnuts and also avocados. The active ingredients are EPA and DHA, vital for brain function. They raise peptide hormone apelin, which enhances the effect of ACE2, and it also raises ACE2 levels. They have anti-inflammatory effects, brilliant for the brain health, brilliant for reducing inflammation within the brain. It's important to take it if you have had a traumatic brain injury, and it has beneficial effects on the brain. CBD raises ACE2 levels. Alpha lipoic acid, you can take that twice a day with food. It's really useful to combat inflammation by inhibiting the shedding of ACE2 from the cells. And you can also consider intermittent fasting. That's a super simple, no cost activity. 12 to 16 hours a day. Do it at night. Just make sure you've got that amount of time between your last meal and last drink that isn't water and your first meal of the next day. And that increases ACE2 levels. How can you how can you rescue your mitochondria, which is your energy powerhouses within your cell? Coenzyme Q10, L-carnitine you can supplement for. I'll come into a summary of all of this at the end of the presentation. B vitamins are really important for mitochondrial enhancement, vitamin B1, B2, B3, and N-acetylcysteine. I took N-acetylcysteine and phosphatidylserine, which has been really helpful for me in terms of recovery from COVID. N-acetylcysteine at the bottom of the bullets enhances niacin, that stimulates mitochondrial function, and it's also used in the treatment of psychiatric disorders to calm down the brain. It's the precursor of glutathione that really rescues the mitochondrial function. So how do you restore your gut microbiome? So here is really to reduce the disease severity. Again, it goes back to whole foods, plant-based ones, rich in vegetables and spices. Make sure you provide that fiber. Don't go and get your vitamin C from squeezed orange juice. Go eat the real oranges to get the fiber and not load your body with sugar. Prebiotic carbohydrates and polyphenols, resveratrol again, enhances A2 activity in the gut and it inhibits the growth of harmful bacteria. Curcumin again enhances ACE2 activity, decreases bacterial virulence by breaking up the biofilms, and ursolic acid is also another dietary compound that's found in many fruits and veg, herbs and spices, including apple peel, dried cranberries, bilb, and so on. You can see all of that. It has anti-inflammatory, antiviral, and cancer-fighting effects. So you can get that from just your normal daily food. There are no drugs out there that support the recovery of ACE2, and there are no drugs out there that support the rescue of your mitochondria. This is all available in your food. Food is your drug in this essence. Please eat the right foods to help you with preventing COVID-19 and also reducing the severity should you contract it and get infected. How do you restore your sense of smell? Parosmia is a distorted sense of smell and taste centers, which is a result of damage to the nerve cells. As they begin to heal, new connections form, which relays different information to different parts of the brain. You can use aromatherapy to help restore your sense of smells, to retrain your brain. And there are 2 links there with guidance on how to do that. In terms of restoring your sense of taste, you can undertake a taste test. So the 4 different types of taste: sweet, sour, salt, and bitter. So just get yourself 4 different vessels full of salt water, sugar water, lemon water, and vinegar. If you can distinguish between all 4 of them, you don't have a problem with your taste, but you do have a problem with your smell if you don't know which one's been affected. Taking fish oil, i.e. omega-3 supplements, can support recovery of your sense of smell, and that's possibly due to the anti-inflammatory effects it offers. You can measure your plasma or serum zinc levels and optimize your zinc, but do not take more than 30 milligrams a day. If you're going to do that, do take it on a full stomach. And coffee has been shown to help restore taste as well. How do you restore your brain function? So here we want to focus on brain cell and synapse repair. So really rebuilding your brain cells, restoring those brain cells, and making new ones, and also repairing the connections between those brain cells. First and foremost, omega-3 fats, 3,000 milligrams a day if you're having brain function problems. Resveratrol, curcumin, I take all of these. Alpha lipoic acid, I've not taken that. Vitamin B3, that's often part of your daily supplement. Take it as a niacin, and you can see the levels there. Fisetin, luteolin, and vinpocetine. Vinpocetine enhances blood flow, and it also stimulates brain recovery following a stroke. So if you are struggling with blood flow, you can measure this by your blood pressure and also by your oxygen saturation levels. Then maybe consider vinpocetine as well. Hope you are finding this all very helpful. How do you help yourself if you're experiencing breathlessness? Well, you could have breathlessness due to interstitial lung disease as a consequence of COVID. The symptoms here are shortness of breath with activity that doesn't improve when you start conditioning yourself with more and more exercise. Scarring or fibrosis of the lung tissues might not be observed on X-ray or CAT scans. So although you may have interstitial lung disease, it's not necessarily going to be picked up. So you can check your blood oxygen concentration with a fingertip pulse oximeter. These are really cheap. You can buy them off Amazon. Go and find one that is suitable for you. The normal saturation is 96 to 99%. Walk as fast as possible for 6 minutes. If it drops, it may indicate you have interstitial lung disease. Do get that checked out by a medical practitioner if you are concerned. Orthostatic intolerance, apologies for the small text. This is basically difficulty staying upright due to weakness, dizziness, and fatigue. And I definitely experienced this. The most common cause is POTS, which is postural orthostatic tachycardia syndrome. Basically, your heart rate speeds up when you stand up, and that is associated with ACE2 deficiency. And that's not surprising, really, because that's the thing that gets attacked first. The test is check your pulse at rest lying down for 15 seconds, multiply it by 4. Stand up and immediately recheck your pulse and blood pressure. Then stand yourself against the wall for 10 minutes and check your pulse and blood pressure every minute. A normal response is you'd expect a slight increase in your pulse or heart rate. Normal blood pressure is 100 to 120 millimeters systolic and 60-80 millis diastolic. If you are experiencing neutrally mediated orthostatic hypertension, you'll notice a drop in your blood pressure that's associated with fatigue. If you stand up and your blood pressure drops, but your heart rate does not speed up to compensate, that's indicative of a neurally mediated orthostatic hypertension. If your blood pressure doesn't go down, but your heart rate speeds up, that's indicative of POTS. Either way, the simple steps you can take is lots of fluid and salt on your food to expand your blood volume. You can wear compressive stockings, but really do seek professional help if you are noticing that and you are not able to recover with appropriate hydration. So what do you need to stock up in terms of your COVID-19 defence stores from a food and drink perspective? So fruits, red grapes, raisins, apples, cranberries, bilberries, blueberries, prunes, berries, anything from a berry family. And apples is really helpful. Olives, nuts, seeds, flax seeds, dark chocolate, cocoa powder. Please go a high percentage of content of chocolate, preferably around 90% minimal sugar. Coffee and tea, super helpful. Herbs, and so coffee and tea is helpful from a COVID perspective, but please drink in moderation because of the caffeine. Herbs and spices, including cloves, peppermint, star anise, spearmint, rosemary, oregano, thyme, sage, and marjoram. Supplements in order of recommendation by Dr. Leo Galland, based on cost and also importance from a recovery perspective. So vitamin D, vitamin D, make sure you have that optimized. Minimum, I would say 2,000 units a day. Niacin, look at your multivitamin to see the volume that's contained. Vitamin B2 riboflavin. Melatonin, as required if you're struggling with sleep. Vitamin B1 thiamine. Resveratrol, found that super helpful. Liposomal curcumin, 1,000 milligrams up to 1,000 milligrams a day. Rosmarinic acid is also really helpful. You can get that from your spices as well. CoQ10, you can consider taking that. And L-carnitine tartrate, also helpful. I would put omega-3 fats from a brain function perspective at the top. That's been included separately. And also alpha lipoic acid if you feel a need to from a brain function standpoint. So next steps. I know I have flown through this presentation, but I wanted to give you the details that you need and also in order to take the steps that are necessary within hopefully an hour's the hour time I had allocated. So please do apply the steps recommended in this presentation as applicable to your situation and your needs. If you are concerned about your brain health, if you want to optimize your brain health and find out how we can support you in doing that, please do register for a detailed brain health valuation. You can do that through contacting us at ruthmaryallen.com/connect, or you can apply for coaching. Brain health valuation is part of our coaching programs if you come on as a one-to-one client, depending on which program you choose. So you can apply for coaching at ruthmaryallen.com/apply. Make sure you optimize your vitamin D and omega-3 levels. Now you can get these levels checked at omegaquant.com/reference/151. If you use the code Ruth Mary Allen at checkout, you will get 5% off. It is the most simple test that you can take. It's just a prick to the skin and you send it off in the post. It's available worldwide, and it's a brilliant way of measuring your levels at a fairly minimal cost, and they will advise what you need to take based on the levels that are reported. If you are not taking any omega-3 whatsoever, I would recommend you start with 2,000 milligrams a day. And if you are not taking any vitamin D, again, I would recommend 2,000 international units a day of omega-3, of vitamin D, in order to boost your immune system function, to help with your brain health, to help with ACE2 activity, to support and reduce inflammation, and to help with mitochondrial rescue. If you are interested in, so I said I would talk about what do we do from a brain health perspective if we have overactivity in our basal ganglia's overactivity in our deep limbic system. Well, one of the most powerful techniques to help with that is actually havening. Now, havening is a psychosensory technique that uses the power of human touch to generate calming delta waves in your mind. And these calming delta waves, the way it works is when you are activated as a result of a trauma, your amygdala goes into a state of alert. And what it does is it plugs AMPA receptors on the surface of your brain cell in your amygdala. And those AMPA receptors then tell the rest of your body what it wants to do in terms of what choice you've made from a fight, flight, freeze, or defensive rage response. And what that does is that heightens regions of your brain associated with that traumatic response. What havening does is it sends calming chemicals into the site of your amygdala where those AMPA receptors are located on your brain cells, where your brain cells are highly activated as a result of that trauma. And those calming delta waves actually unplug the AMPA receptors from the surface of the brain cell and send them deep into the brain. So it literally down-regulates your brain. So if you imagine the images that I showed you recently, we had those red hot spots in our brain due to heightened activity in the deep limbic system and the amygdala, as well as the basal ganglia centers. Havening can calm those areas down, and because of the way it works, it's actually a very targeted approach to calm your brain down, and it's a non-intrusive one. It doesn't require any drugs. You can learn it yourself, and if you go to the screen below you, there is an offer of havening, learn how to self-haven, which you can do for yourself. Not recommended if you have a traumatic experience. So if you have experienced a trauma as a result of COVID, please do connect with us, and we can offer you sessions to support that. You can also register for trauma recovery group coaching, which is available at 30% off which is using our emotional mindset management approach, which combines havening with brain health coaching. We go through our 5 pillars of brain health as part of the session. You don't have to say anything about your experience to benefit from this. The group sessions start from only $66 with that discount code applied. If you visit ruthmaryallen.com/havening with Lily, you will access the course. If you visit ruthmaryallen.com/trauma recovery, you can register for the group coaching. That offer is available until the end of next week, which is the 17th of December, Friday, the 17th of December. The offer expires, so it's only available for a limited time. And that will help you reduce any overactivity that has occurred in your brain as a result of the trauma that you may have experienced from COVID, whether directly from catching the virus or indirectly of the experiences that you've had due to lifestyle shifts. Now, I hope you found that presentation helpful. I will now go into just being me. I'm going to go and check my email to see if anybody has sent me any more questions. But while I'm on, I will seek to answer the questions that have already been submitted. Let me just check my email and then I will go to the Q&A. So no other questions have been submitted, and that's fine. So the first question was, are different parts of the brain more affected depending on the symptoms, such as poor concentration and brain fog? Does that affect different areas compared to someone who suffers severe migraines or has a stroke after contracting COVID? So it will completely, I don't know the full answer to this question, to be fair, but yes, different parts of the brain will be impacted depending on the symptom that you experience, because different parts of our brain are responsible for different brain functions. So if you have experienced a stroke, depending on where that stroke is located in your brain, that part of your brain will be impacted by the stroke, and that stroke, may be attributed to a loss of blood flow to that region of the brain. So what you really want to be doing is focusing on restoring your blood flow and also reducing inflammation to aid recovery. Brain fog is possibly a result of, as I mentioned earlier, of increased inflammation in the brain as a result of the effects of COVID. And that's most likely inflammation within the prefrontal cortex. Your history that you have associated with your brain is really important in this context. So I had moderate traumatic brain injuries and multiple of minor knocks in my brain, and that may have contributed to the struggles I experienced with my brain function as a result of contracting COVID. But focusing on the treatments that I've discussed during this presentation, that has really helped me recover. And as I said, I've now take curcumin, resveratrol, N-acetylcysteine, phosphatidylserine, which is really helpful for brain function and memory, and optimize vitamin D and omega-3. Both of those two are really vital to support your ACE2 activity and recover that, and also help with any mitochondrial rescue that may be a result of some of the brain fog issues, as well as inflammation within the brain. So severe migraines are often attributed to problems with ACE2 activity and mitochondrial function. So if you take the steps that are recommended in here, that can help with severe migraines for people that are suffering after contracting COVID-19. I will put that detail specifically in the Q&A that I'll attach in the once this presentation is made available later. The second question is, some people are having effects from COVID vaccination that are similar to having had COVID itself. Does this mean the vaccine could potentially cause brain problems in the short or long term? So there's not really enough evidence to suggest that it causes short or long term problems. But as I mentioned in the presentation, the vaccine does produce an immune system response. That immune system response could result in increased levels of inflammation within the body. Now, if you haven't optimized your brain health and you do experience inflammation within the brain, that could affect your brain function. That could also affect other parts of your body too. So it will depend on how your immune system responds to the vaccine. So it's really important in this instance that we take the steps to help ourselves reduce inflammation that we may already have in our body. And I experienced pain within my shoulders. Thought, crumbs, this is an indication as to where within my body and my mind I have inflammation that's not been fully addressed. And I had inflammation in other regions of my body too, where I knew, like my lower back, I had pain from after getting COVID. That was a site where I had an epidural, and I've had ongoing lower back problems there that flared up when COVID happened. So really focus on optimizing your omega-3 levels, making sure you're taking a minimum of 2,000 international units a day of omega-3, and the maximum that's appropriate based on your omega-3 index. What would you say the most pervasive issue is when it pertains to operating at an optimal level with your brain? The most pervasive issue. So I think the most important thing that we can focus on enable us to operate at an optimal level is our sleep. That's the most important. And we know from a brain, from a history perspective, we now as a nation get 40% less sleep than we did back in the 1930s, 40s. We used to get 9 hours of sleep at the turn of the century in the 1900s, and we now get on average about 6.5, which is not enough. So we really need to stop this always on mentality with our lifestyle, which is really going to kill us as a race, to be fair, and focus on putting sleep first and foremost if we want to support a long-term brain health. And as I said, it's the most important factor from a brain health perspective, and it's the thing that your brain wants to do and your body wants to do when you're under attack from a virus or a cold. You don't go, oh, I think I'll just go and go and do some exercise. You don't go to yourself, well, I think I'll go and eat a whole heap of vegetables. What your body tells you to do first and foremost is sleep, and that sleep is vital to help your immune system build up its defenses to do the work it needs to do to help your cells recover, to help your mitochondrial reboot their energy centers so that you've got energy the next day, and so on. So and also to help your cells clear all the toxins out of the cells, because your brain washes itself at night. So if you don't get enough sleep, and you become hugely dysfunctional. That's the most important part from an optimal brain health perspective. I hope this has served you. This presentation has been an absolute pleasure being on here today to bring you some hopefully really helpful and really important information in the run up to Christmas on the steps that you can take to really help you improve your brain health and help you minimize the risk of long COVID and minimize the impact of COVID on your health, and getting severe issues with that. I'm just going to go back on this just to give you a reminder of the supplements that you can take. And as I mentioned, it's vitamin D is really important. Make sure you take a quality multivitamin, resveratrol, omega-3 fats, and curcumin, which I haven't put on here. I don't know why that's missing. Curcumin, it is number 7. Curcumin is really important as well. And all of those ones. So they're done in order as recommended by Dr. Leo Galland. The niacin and the vitamin B2 you can get from, and B1 you can get from a multivitamin. Check the volumes within that multivitamin. Get a high quality multivitamin. Melatonin, only do take that if you need it from a sleep perspective. And then obviously you can do 8, 9, and 10 if you feel it's appropriate. And you'll find further details of what those actually support earlier on in the presentation. Right. As I mentioned, if you do want further support to help you with reducing any overactivity you have in your brain, you can register for group coaching to unchain your pain. That's ruthmaryallen.com/trauma recovery. And you can also register for an online course, Havening with Lily, ruthmaryallen.com/havening with Lily. And they're both only $66. It's not much investment for something that could really help you for the rest of your life, equip you with the appropriate tools to help you take back control of your mind. I am going to leave this now. As I said, it's been a huge pleasure. I wish you a healthy and happier Christmas, and do make sure that you look out for the next live training and Q&A on brain health as part of my show, Brain Health: Unchaining Your Pain.